I understand that it's a personal choice. However, as a clinician and as a nurse, I find it really hard to understand why other clinicians wouldn't have a jab. The success of vaccination programs are based on as many people as possible getting vaccinated. So as a group of people that work with patients, ill people, it's our responsibility to get vaccinated. So we all recognise that there's vaccine hesitancy and there's also vaccine fatigue. Personally, I think there is a moral responsibility to have a flu jab if you're a clinician and you're working with patients. I think people falsely assume that because they're fit and well and their risk factors might not be apparent, that should they catch flu, it'll be a mild thing for them. And that might be the case, but the person that they pass it on to, the consequences could be very different and they could be really ill. Everybody's different. With respiratory viruses, you don't really know when you're infectious. You might just think you've got a cold, you might carry on coming to work. So yes, you can pass on flu viruses to people without knowing that you've done it. Flu can be really serious if you're old or if you're young, if you're immunosuppressed or if you've got a chronic illness. So the patients that we see could be all of those things, and we can easily prevent that with a flu vaccination. So it's really important that we all get our flu jabs this year as every other year. And the reason we need to get it done is because we're going to protect ourselves. We're all in and out of clinical areas. We're working with patients that may or may not be infected. You're more likely to take that infection home, potentially spread it to your family and friends. You might have vulnerable relatives. You might have older family members at home and young children. You really don't want those to get flu from you.